From ravaging floods in Nepal to a hospital fire tragedy in Pakistan's capital, it seems to be a week of unfortunate incidents in South Asia. Early on the 26th of August, at least 14 newborn babies died in a fire at a state-run hospital in Islamabad. The Wednesday's tragedy, among the deadliest hospital fires in recent years, has brought the focus back on poor safety laws and building codes, as well as lax enforcement in Pakistan. Our next report gets you more details.
The Pakistan Institute of Medical Sciences, or PIMS, is one of the biggest hospitals in Pakistan's capital, with 156 beds in its maternal and child health unit. Early on Wednesday, a fire broke out on the third floor of the mother and child unit at the state-run hospital. The newborn babies in the ward were either in incubators or hooked on oxygen equipment. It is to be noted that oxygen is not flammable on its own, but it can accelerate a fire, making materials burn hotter and faster. Reportedly, an air conditioning unit caught fire, which soon spread, killing 14 of the 15 babies who were in the ward at the time. Chaotic and harrowing scenes were described by eyewitnesses at the hospital, including intense smoke and broken glass, with some complaining that rescuers were slow to respond.
At around 5:45 or 6 in the morning, we heard about 10 to 15 very loud explosions. We were sleeping outside in the hospital's porch. At first, I thought perhaps they were firing a ceremonial salute for Rabi al-Awwal because they sometimes fire cannon salutes, so I assumed that was what the sound was. About 10 minutes later, my brother-in-law went upstairs and called us from there, saying that the ward upstairs was on fire. We immediately ran upstairs. We didn't even have shoes on. When we reached upstairs, we couldn't get as far as the ward because it was completely filled with smoke. We couldn't see anything ahead, and it was becoming difficult to breathe.
Fortunately, 7 other babies, 2 men and 10 mothers were rescued from elsewhere in the hospital. According to Pakistan's Minister of State for Interior, Talal Chaudhry, some families recognized their deceased babies through their wristbands, while others could only identify them based on their ages. Some of the babies were only 3 hours old. An inconsolable Javeria, who lost her infant in the blaze, said the door to the neonatal intensive care unit was locked and lambasted what she said was a slow response from emergency services.
They arrived after 2 hours. For 2 hours, I kept crying and wailing. Then, these people broke into the ward from here. Rescue team arrived too late. Police arrived after 4 hours and said they are here to investigate. To hell with you, rescue team and police. Babies burned to death there, but nobody could save them. What did they go to get downstairs, leaving the children alone? The door of NICU was locked. I do not believe this. Give me my child back. My demand is, I want justice. Why were the doctors not caught by the same fire? Why did the doctors leave the children there? 1 nurse, 1 doctor, 1 gynecologist, 1 pediatrician. There was nobody in the entire ward. Why were they not there?
Pakistan's Prime Minister Shehbaz Sharif, who chaired a high-level meeting on hospital fire, expressed deep anger, called for an investigation and sacked Health Secretary Aslam Ghori, the country's top civil servant for the department. Talal Chaudhry, addressing the media outside the hospital, said that authorities would launch a probe and that the bodies of the 14 babies had been handed over to their parents.
इस रेस्क्यू ऑपरेशन के फौरन बाद तमाम शवाहिद Immediately after this rescue operation, all the evidence based on which, in the coming days, the inquiry team will investigate and reach a conclusion, and the process of punishment and accountability will then begin, and alongside that, whatever changes are required in planning to prevent such incidents in the future.
Taking note of the tragedy, the United Nations Children's Agency, UNICEF, said it was deeply saddened by the deaths and called for an urgent review and strengthening of fire prevention and safety standards across health facilities. In Pakistan, where safety laws and building codes are not adhered to strictly, fires in large buildings are frequent. In January, more than 65 people were killed in a shopping center fire in the port city of Karachi. Though the government healthcare is subsided, the facilities are under-resourced and more often than not, overburdened. Watchdogs have time and again criticized the state-run facilities as mismanaged. Tragically, the unfortunate death of 40 newborn babies is yet another grim reminder of the issues Pakistan needs to address rather urgently.